Hey y'all, and welcome back to my channel. On this page, I talk about technology and money. If you are new here, welcome. I welcome you to subscribe. And then if you're returning, welcome back. I hope everyone is having a good day so far. So today I want to try to make this a quick one, just with some stories that I came across, and just some good reminders around automation and robotics in healthcare, the future of work, not just for nursing, but also for other healthcare professionals, and just some good reminders around how we use apps and the privacy and security of our data. So I'm going to start with a hospital robot dietitian. And the reason why I'm sharing this story is this is the first time, like, we've seen robotics and automation being used for nursing care. So we have seen that with I did a video last year about how robotics and automation is increasingly being used, and how it's impacting and revolutionizing nursing care, but then also pharmacy. But this is the first time, this article that I'm about to share, this new robot dietitian, is the first time that I have seen robotics and automation being used for food and nutrition in hospitals. Okay, so our first article comes to us from the Low Country of South Carolina. Here, let me share my screen. Can y'all see that pretty good? Okay, so this is it. Essentially, it looks like an iPad on a stick. So it comes from the Regional Medical Center, which is in Orangeburg, South Carolina. That's considered the Low Country. Orangeburg is about an hour outside of Charleston. It's about an hour west of Charleston, and then about 45 minutes or so east, I believe, of Columbia, South Carolina, which is the capital. So that's the CEO and president of the hospital. So the article comes from us from the Times and Democrat, very well known, very well established journal outlet in the Low Country. And so it says the Regional Medical Center has a new employee to help with its food and nutrition patient counseling services. The new employee is named Norma, the robot dietitian. So the hospital's food services department is managed by Georgia-based Morrison Healthcare. The company oversees the hospital's nutrition program and hires all the hospital's food and nutrition counselors. So what this is telling me is that this hospital is using, they're contracting out their food and nutrition services, right? They have a third-party vendor. It's not in-house. It's not managed in-house. It's third party. So it says Norma is a food and nutrition automated robot that can provide counseling for patients in regards to food and nutrition. So nutritionists are on our staff through our food and services through their agreement, but having a robot helps provide better staffing and better coverage for patients because staffing for nutritionists around the country is very tight. So I knew there was issues with nursing staffing. That's very well known. I'm starting to see more and more talk about shortages in physician staff. And I did not know with food and nutrition services, which is a very integral and key part of hospital health system inpatient care. I didn't know there was also workforce shortages for food and nutrition and dietitian services. So that ancillary clinical specialty is also becoming more automated and using robots. So the hospital has 4 registered dietitians. So those are humans with plans to add a 5th live on-site registered dietitian. However, the robot, and this is interesting because this robot, which if you hadn't here, I'm going to show it again here. Looks like an iPad. Essentially, it looks like an iPad on a stick, and it has looks like it's lit up from the bottom. I do see a camera here, on a patient-facing camera there. And since this is a robot and moves around, I'm just going to assume that that is wireless and connected to the Wi-Fi network because I don't see a data. I don't see the device plugged into a data outlet. I just see where it's plugged in here to red power, which makes sense. Let's see. Okay. All right, so we're just in the process of introducing this, said the CEO. It is demonstrating that we are definitely moving into the high-tech area. This article is short, so we're almost done. Let's see. Oh, so it's piloted off-site. So the robot is in-house, but it's piloted off-site by it's almost like it's like a virtual dietitian by one of the company's employees, and the robot can walk halls and visit patient rooms to provide counseling for patients on their dietary needs and recommendations. And then they're also planning to use the robot dietitian on outpatient basis. They talk a little bit, very high level, about the fees, but they don't get into it. It's just saying, the CEO is just saying that the cost of it is covered in the third-party contracting that they do with this company. So it says the robot can be controlled from across the country. A demo showed to hospital leaders, was piloted by an employee who was based in Nevada. This is really key. So the next few lines are really key to me, and I'll tell you why here in a minute. So it says hospital leadership saying that the program will save money and cut back on the need for a salaried employee. So essentially, this is telehealth clinical nutrition. So the robot can provide nutrition assessment, nutrition intervention, monitoring, and also patient and family nutrition education. So if you're not familiar with hospital food and nutrition services and dietitians, typically that's done by a registered dietitian. They're in-house, just like traditional nurses at the bedside. Registered dietitians traditionally are like in-house. They're at the bedside, providing care in their specialty, just like nurses and respiratory therapists and other providers do. It says telenutrition services are used to provide clinical nutrition services in times of staffing shortages, specialist clinical dietitians, and nutrition education for high-risk outpatients at home. So there again goes that hospital without walls. And I've talked about on this channel, and some of you all may have seen the rise of hospital at home programs, which hospital at home is not your traditional home health model. It is hospital inpatient level care in a patient home. So the service also allows family members and caregivers to attend patient education from multiple locations. It's almost like FaceTime for nutrition services. The robot uses software designed to protect patient healthcare privacy, which would be key, right? Because it's a software. It is piloted by an employee that is not in-house. The device looks wireless, so data is going across the network. So I'm sure that would be a concern with PHI. And then it says the robot is used in about 10 other hospitals across the country and often serves as a supplement to on-site staff or as a sole on-site dietitian. So it sounds like with it only being in 10 hospitals, it's not, there are literally thousands of hospitals across the United States. So this sounds like a relatively new technology, and they do also say there are some hospitals that only have the robot dietitian in their facility, according to the company that provides the robot. So again, it speaks again to just the future of work for all healthcare workers, the continued innovation and embracing of technology in all avenues. And it's just a good reminder to, no matter what specialty you work in healthcare, that to stay aware of the different technologies that are being implemented for your specialty and how it's going to impact your practice, whether you are a registered nurse, a provider, or in this case, a dietitian. The second article, really quickly, that I will touch on, let's see, cool, we're only 9 minutes in, is TikTok. Now, this is a little bit of an older article. It's about 2 weeks old. I came across it over the holidays, but I haven't had a chance to talk about it just yet. But this article talks about 5 ways TikTok is seen as a threat to U.S. national security. So if y'all aren't familiar with TikTok, I know it started off in from what I know, as a dancing app. People dance on it. But as I read through this article, it's just a good reminder on, I have heard say, anytime you download and use the app and it's free, it's not really free. If an app doesn't cost you anything to use, you are the product, right? Because it's using your data, whether for marketing purposes or other reasons like that. A TikTok, an Instagram, a Facebook, right? In comparison to like an Instacart or like a Netflix, which you pay for, which they're also using their data, but you're paying for that. It's a little bit different than versus like these social media platforms, which cost nothing, right? So the article comes from Business News. Yep. And as always, I'll be sure to leave a link to all references in the description box. And it says, many in the United States see TikTok as a threat to national security. And it names 5 reasons. The first is data sharing. Here, and I'll highlight that. So TikTok, just like other social media sites, thrives on data. And the app is also very addictive. Now, I know I've seen folks say, when you've been scrolling on TikTok for a long time, it sets a reminder, say, hey, you've been scrolling for a while, take a break. And from what I understand, that's because people will literally sit and scroll on TikTok for hours and hours and hours. So critics of the app worry because, like, according to this article, it's not a United States owned company. TikTok or the Clock app is not. But then it's about how the company that owns or the people who have access to the data, because it's such a wealth of data. There's so much on TikTok. It's more than just dancing, right? I've learned things on TikTok, how to fix things, how to do renovations, how to cook certain recipes, news. Like there's the Under the Desk news account on TikTok that talks about world news that is not necessarily always talked about on public television, on like your ABCs, your NBCs, etc. So here's an interesting quote here from the Sanford School, from a fellow in the Sanford School of Public Policy. It says, quote, if we're talking about U.S. citizen data, it's the wild, wild west. There's very little regulation. Companies collect tons of data all the time, whether they're foreign companies or American companies, end quote. And it sounds like, according to this article, that TikTok is moving their server farm to a United States only based server farm in a project called Project Texas. And that's here in the article. So the second way it's seen as a potential threat is detective, which I did not know that there's the potential in this app, like other apps. Once you install the app on your phone, it can automatically turn on the camera on the microphone without you being aware of that. That's the second threat. The third is censorship. And it's just, again, this is not a United States owned company, and just different ways that the app can be used to censor in different countries besides the United States. The fourth way is misinformation. So very similar, that happened back in 2016 with the United States presidential election, how another country used Twitter to spread misinformation. And then the fifth way, again, because the company is not a United States based company, and how the app itself can be used for nefarious political reasons. So the last article, and I want to wrap up here and try to get this under 20 minutes, is, if you had not heard, again, which I had not heard, this article is just from yesterday, but there were 235 million Twitter accounts that got leaked by hackers. So if you have a Twitter account, hopefully you have MFA or multi-factor authentication or a very secure password. So this was a bit of a surprise. Also, considering it was a a surprise considering all that has happened at Twitter over the past couple of months with the purchase and just the transitions or transformations some may consider that's happening over there. So this article comes from the WAPO or the Washington Post, and it says records of 235 million Twitter accounts and emails used to register them have been posted on an online hacking forum, given the potential for anonymous handles to be linked to real world identities with threats of exposure, arrest, or violence against people who use the platform to criticize governments or powerful people, right? Or open up others to extortion, right? Hackers could use the email addresses to attempt to reset password or take control of your account, especially if you don't have multi-factor authentication or two-factor authentication. If you're not familiar with MFA or multi-factor authentication, that's where you have two methods of accessing your account. Like if you log into your bank account, you log in with your password, and then it also either calls your phone or sends you a text message with a code, and you enter that code in to say, yes, it is me accessing the account. Right. The only thing with MFA, if you're not aware, if you use LastPass, which is a multi-factor authentication platform, got hacked right before Christmas time. So it's really interesting. All these hacks and leaks are happening around the same time. Let's see. Let's skim over just a little bit more. It's saying that these records or accounts were probably compiled, it says, around late 2021 using a flaw in Twitter system that allowed outsiders who already had an email address or phone number to find any account that had shared that information with the social media platform, and then those lookups could be automated to check an unlimited list of emails or phone numbers. Twitter learned about the vulnerability last in August. It also says that, which I missed, last July, hackers were spotted selling a set of 5.4 million Twitter account handles and associated emails and phone numbers, which is when they first realized that something was going on. Let's see. There was one other thing that jumped out to me. Oh, here we go. So they knew, it sounds like the flaw that initially exposed emails last summer got fixed. But since that time, it also says that the company or the social media company has laid off many of its security staffers. So that's it, y'all. If you've missed the news and what's going on with these social media accounts and the hacks and the leaks, it's just something to be aware of, right? Yeah, multi-factor authentication. If you don't have it, make sure you have strong passwords and always do your due diligence. Like I always tell you guys, don't believe everything that I say, right? Don't just take anything that you see, any influencer or social media personality talking about and just run with it. Always do your own due diligence and just stay safe. All right, that's it, y'all. Thanks always for tuning in. If you made it this far in the video, please do like and also consider sharing, and I'll see you in the next video.